Our next speaker is Dr. Damali Martin from the National Institute on Aging. And the presentation title is Critical Thoughts about Health Disparities with the NIA Division of Neuroscience. So you're very welcome. You can start right now and share your screen, please.
Sure. Can everyone hear me? And can you see my screen?
Yes.
Yes. Okay. I think I need to go into presentation mode. That sorry, it looks like I'm a bit. I think my screen is frozen.
It said that you have started screen sharing, but we cannot see.
Okay.
The actual
Let me stop sharing and. Okay, I think my computer on me, so I apologize. This has never happened before.
That's okay.
Okay, let me see if I could quickly resolve this. And,
I think her Zoom application was.
okay, I think I'm going back in. Okay, let's see if I could do this again. Okay, the screen?
Yes,
With the slide?
Great,
Okay.
yeah, that's it.
Great. Okay, thank you so much for your patience and my apologies again. I'm Damali Martin. I'm relatively new to NIA. I've been here for a little bit over a year now, and I'm enjoying being part of the team. My current position is to serve as the Minorities Health and Health Disparities Coordinator for the Division of Sciences, where I help coordinate and plan for minority health and health disparities activities in the division and in collaboration with other NIA divisions, other NIH ICs. And just a little bit of extra information. I was previously at the National Cancer Institute, where I did very work as a program director there for 12 years, managing epidemiology cohorts focused on minority populations for research on cancer. And so I look forward to continuing to do this type of work at NIA. So just so you know, the National Institute on Aging is the leading institute for aging research, and a number of things to support our mission. We support and conduct genetic, behavioral, social, and economic research on aging. We foster the research in clinicians, scientists in aging. We provide research, and just as important, we disseminate the information about aging and advances in research to the public, to healthcare professionals, and scientific community, and a diverse number of. And so, as I stated earlier, I'm within the Division of Neuroscience, and our mission is to advance research leading to a better understanding of mechanisms of brain aging, Alzheimer's disease, and related dementias. And we do so in a way that considers, that looks at the research as a continuum, looking at basic science, population science, looking at how we translate the information, funding clinical studies, and looking at epidemiologic studies, and then our strategic development and partnering Partnerships Office coordinates all the activities across the branches that are covered by the branches, the activities in the scientific areas. So when we think about disparities, or at least when I think about disparities, these two studies are the studies that come to mind. So to really understand why we see differences in the incidence and prevalence for AD and related dementias by race and ethnicity. So you may be familiar with these two papers. This might be blocking. I'm going to move this out of the way. My title, I think that's better, yes? So you may be familiar with these two papers, but the differences in incidence and prevalence of Alzheimer's disease and related dementias among US race and ethnic populations are, so we see a higher age-adjusted incidence among African Americans and American Indian and Alaska Natives, and a higher prevalence among African American, Hispanic, Latinos, and American Indian and Alaska Natives. And we've also observed disparities among underserved groups. For example, sexual gender minorities, rural nations, and of course, I've heard many times that Alzheimer's disease really affects women. And so looking at this as sex as a biological factor and looking at this in women is also very important. And often factors that intersect race and ethnicity. And so with this question, and it's really important that we take a comprehensive at everything that could affect the individual if we're going to really understand not just disparities, but what we can do in terms of intervening at the individual level. So we have some additional research that has been done looking at neuropathological differences and differences in biomarkers. These are a number of studies that are listed in the table that have identified either differences in a number of biomarkers for AD and no differences for among different race and ethnic groups. But as you can see here, there are a number of challenges that need to be addressed. For one, the sample sizes are really small in some of these studies. In some of these studies, they're not population-based, and so the populations may not be representative of all ethnic minorities. Most studies have been done in African Americans or African descent groups and in some other race and ethnic groups. And so what this suggests is that there's a need to do further evaluation of the ATN framework, and there's a need to consider diverse populations within the context of various environments. To this idea of taking a more of a precision medicine approach or a precision public health approach. And the NIH Health Disparities Framework offers us an opportunity to be able to take precision medicine or precision public health approach when we're looking at disparities. So the framework indicates that there are multiple factors that act across multiple domains and across multiple levels of influence. You see that there are many targets that we could work to intervene on, and there are many ways in which we try to discern what is leading to disparities or what's leading to overall what factors within a particular population would lead it to have that population to experience a higher burden from AD and related dementia. And so with that, I wanted to share with you our division's interest. We're interested in research on recruitment and retention of diverse populations. Support research to understand the demographic diversity of dementia risk. It really goes beyond the description. So what we're hoping to do here is to really support research that leads to understanding of causal pathways. We support analysis of the relationship of race and ethnicity, demographic diversity on risk and resilience for mild cognitive impairment or AD. We are interested in supporting research that disparities in diagnosis and assessment procedures, including cognitive tests, clinic participation rates, and validity of others. We're very interested in investigations that create a multi-level precision medicine approach. And I will talk a little bit more about this, a concept that was just developed and just approved by our council. But we are very interested in supporting studies that use this approach to understand neurobiological pathological difference among diverse populations. And of course, we are very interested in genetic studies of AD and ADRD and minoritized students. And you will see later that we are supporting a Alzheimer's disease sequencing project, which has made tremendous progress to find the populations included in large-scale sequencing projects. So over the next few slides, I just want to present a few examples of the types of research and the types of projects that we support in our division. So this first one is the Health Disparities in Alzheimer's Disease, NOCI. I listed the NOCI number here, and this is a collaboration between and the Division for Behavioral and Social Research. And the goal here is to support investigator-initiated awards for health disparities research. So one is the ethnic disparities in ADRD risk, the case for Arab Americans. And in this study, you can see we're collecting information on a number of different factors covering domains. And this will enable them to do a comprehensive investigation as to the causes of disparities or the causes of factors that are contributing to AD or dementias in this population. And we fund many grants that take a similar step in investigating different minority populations in the US. Okay. Project is the Alzheimer's Disease Sequencing Project, which is led by Marilyn Miller. And they've done a tremendous job in increasing the diversity of patients in large-scale sequencing projects. As you have known, historically, the populations included in large-scale genomic projects have been mostly of European descent, with probably less than 20% of minoritized populations. And if we look at the minoritized populations, mostly Asians included, and less of African descent, Hispanic, Latino descent, and so on. And so what we are working to do, of Maryland, is to really increase the diversity of populations with our Alzheimer's disease sequencing project. And this is just an idea of where we are in terms of numbers. What we hope to do is get at least 18,500 cases of the ethnic groups, starting with Hispanic, Latinos, African descent, and then continue to diversify as much as possible moving forward. This is another research initiative that's led by Dr. Elliott in our division. And what she is aiming to do is to examine diversity recruitment in aging research. And so the goal of opportunity is to improve the research participation recruitment through method development, community engagement, and evaluation strategies and community incorporation. And the collaborate teams would support the timely and essential resources designed to enhance recruitment and retention of large, diverse populations for aging research. So it's currently funding 15 projects, and they cover minoritized and medically underserved populations based off of race, ethnicity, languages, and other health disorders such as the elderly, hearing, vision, mobility impaired, secondary minorities, rural populations, and under-resourced populations. So that moving forward, that we would create several hubs or several or experts that will help in terms of recruitment and for future research related to aging and AD and related dementias. This is some additional work that we are on that is currently ongoing within NIA to continue to improve recruitment. This example is being led by Holly Massett and Rebecca Roper through our Division of Neural Activities. And we in the Division of Neuroscience are currently collaborating with them on this. And so there were two that they led. The first one was really to assess the potential to develop a practice-based research network that will help address disparities gap with recruitment and retention of diverse and underserved patients. And a virtual meeting was held in April, and this will be followed of a request for information, which I would share with you in, on the next slide. Holly also developed the clinical research operations management system, or CROMS, with the goal to really be able to track recruitment in real time for our clinical studies. And this system, which has already rolled out, require those researchers that are clinical studies to put their participant recruitment and retention of the clinical studies, particularly those of minority population system, so that we could track this real time. We could identify what's needed and identify and intervene in real time to help address any challenges with enrollment activities, particularly for our underserved populations. RFI that I mentioned, this is anticipated to be released. I believe it's going to be sooner than winter 2022 because things seem to be moving very quickly. But the objective is to collect practical insights on barriers and solutions as to how to increase the diversity of an ADRD clinical trial participants through sustainable engagement community-based research entities. And so release the RFI, I'd be more than happy to share that with you and with who may be interested, but they're really looking for feedback from you. So they're looking for feedback from stakeholders with experience engaging represented and historically minoritized groups, based research networks, AD clinical trial researchers, persons living with dementia or family members or others who provide support for those with dementia, patient advocacy groups, and any other group that's not mentioned here. We welcome comments from everyone on the RFI because we need you to be able to move forward together in this endeavor. One of the things that we are currently doing within our division is an assessment of our division. And the goal here is to really take a deep in our portfolio to understand what types of resources we have, the types of cohorts, and other epidemiologic studies that we have supported over years, and to take a look at the populations, the geographic representation of the populations. And the goal here is to not only to identify sciences, but to also identify new opportunities for funding. We're trying to define a roadmap as to how we move forward. We want to encourage the use of NIA's framework, and we want to increase the communications to the scientific and lay community webinars, blogs on disparities, and that will disseminate information on the research advances that has in this area. So stay tuned, because we will be communicating more about disparities and what we're supporting with division. And as I mentioned before, this is a new concept that was just approved. The name of this concept is Precision Medicine Approaches in Addressing and ADRD for Minority Health and Health Disparities. And we this concept because there's really a need to that captures not just the neuroscience, but to combine that with the environmental, social, cultural, behavioral, and demographic factors that often intersect race and ethnicity. And while we support a number look at this, the support for this type of research could certainly be increased. And so what this funding opportunity will do, it will support planning activities for the development or scale up of emerging studies in minoritized populations. It will support pilot projects that plan or will utilize a multi-level medicine approach, and that will inform the scale up for future research. We're also going to encourage the formation of disciplinary teams, because we really need people from different disciplines to come together and do the type of research that would create a shift within the field. And so we really want to develop formative multidisciplinary teams to be able to research questions that will come under this funding opportunity. And we're hoping to get the funding opportunity out on the road soon. So again, stay tuned. So in terms of the future, we want to encourage increased representation of diversity in our studies, to seek ways to leverage in cohorts and data sets for research in race and ethnic minoritized, underserved populations, to continue to improve study design in our tools, to continue assessment of our research in this area so that we could identify opportunities and address scientific gaps, to also identify and disseminate information about advances, and to continue to seek opportunities for collaboration with other NIH agents and NIHICs. So I would like to stop there, and I don't know if I'm out of time for questions. Happy to take any questions now or in the future. If you look me up on the NIA website, my email will be there. So please feel free to reach out anytime with any questions. Thank you so much.
Okay, thank you very much. Thank you, Damali. And actually, we have some time after presentation before the roundtable. Thank you for this very clear description of the really its critical thoughts about the division, purposes, and study directions. If some people in the internet audience or in the room have questions, so we can right now to discuss it. If no, then we can make a very brief break before the roundtable. So I cannot see some questions in questions and answers chat. Okay.
I think Yuri Loika had a question.
Okay. Okay, so can you ask this question, or because I cannot see? Where is it on the screen?
Where, in chat or where?
No,
No?
I think he can ask it directly. It's not. Oh, there he is. You can unmute yourself and ask the question.
Can you hear me? Okay. I would like to ask a question about the structure and approach of NIA in collecting data. Currently, there are two approaches. One is cross-sectional, large studies, and the other approach is to collecting longitudinal information. And there is advantages of each of this approach. And considering, for instance, comparing US-based studies to UK Biobank, and UK Biobank is most of the data, they are cross-sectional. And in US, there are a lot of studies with longitudinal data. How NIA okay, in which direction NIA will extend either in cross-sectional or collecting longitudinal data? What is the preference?
So to make sure that I understood your question, you're asking what types of, what method we prefer, longitudinal or cross-section? Is that what you're asking?
Yeah, what is the preferred method for collecting data? Is it large cross-sectional or collecting fine longitudinal data?
It really depends on the research question and what goes into do. If you're looking at issues related to trends, or if you're tracking outcomes over the long term, you want to show a I guess a causal pathway, then longitudinal would be the way to go. But we do understand that there are sometimes challenges in terms of trying to understand associations with AD, because the data that's available would be very limited. If that's the case, then you have to try and design with what you have, or work towards building towards getting better and additional data. I don't know if that answers your question.
Yeah, the other part is that previously in the longitudinal study, it's a bit difficult to perform research on disparities and how it be balanced in the future.
Yeah, we're aware that there are groups or people who are really trying to build up cohorts and longitudinal studies. I was seeking ways of supporting those types. And so the new concept, which I provided the link for, and I can't say more about it than what's on the slide, but the whole idea was to emerging studies that are emerging. So you take a look, if you're a PI for an emerging study, stay tuned when the FOA take a look at it and see if that's something that will help you.
Thank you for answering.
Sure.
Damali, can I have a question? What again about preferences of NIA between maybe basic science, population science, clinical trial? How would you distribute percentages?
Yeah, so to be honest with you, we really don't have a preference. I think historically there's been some areas that have been easier to expand in terms of disparities and minority health than others. I could tell you that our director for the Office of Special Populations, Patricia Jones, is very interested in trying to encourage research for disparities across the NIA, including an origin of aging biology. And so the director for the Division of Aging Biology was specifically hired, Stacey Carlton was specifically hired to try to increase disparities research within their division. And so we don't really have a preference. I just think historically it's been easier for some groups or some types of science to move than others. Yeah.
A lot of presentations at our workshop was based on Medicare data analysis. Do you think that this is valuable source of information specifically for disparities research?
I'm sorry, could you repeat the question? You didn't quite get the first part.
So I'm speaking about Medicare data. So we had a lot of presentation based on Medicare data, and
Okay.
researchers suggested different approaches involving this data. But administrative data are administrative data, yeah, with certain limitations. So we have strengths and limitations. What do you think, what overweight what?
Yeah, I think and again, I think the challenge is really going to be us working to try and understand what types of research we supported, what types of resources have been used by our investigators, whether it's Medicare linkage or linkages to other database, and to see how we can enable research in this area. I'm sorry, I don't have the best answer right now. It's one of the reasons why we're taking a deep dive into our portfolio to try and address some of these issues.
And my last question about health economics. We discuss between us, and sometimes people say NIA does not support health economic studies. Then somebody tells that in opposite. And what would you say?
Yeah, so our division on social sciences supports quite a few studies on ethics. Actually, one of the branch chiefs there, John Phillips, I believe he has an RFA or funding opportunity that looks at economics of AD. And I could look for that funding opportunity and share it if you're interested. But it's something that's done mostly by division. It's a very important area to look at. So I wouldn't say we're not supportive of it, but there is a division that's currently looking at that.
Thank you.
Sure.
Hey, thank you very much, Damali. So for your responses and for wonderful presentation. And I think now we can move directly to the roundtable. And we have a roundtable till 4:30 p.m. and two chairs, me and Dr. Igor Yakushevich. I just have one question. We have in our agenda Dr. Mackenzie Fowler from the University of Alabama at Birmingham poster presentation, and how we're supposed to show it, to announce it, to discuss it, because it's together with this roundtable in our agenda.
Yes,
probably you can comment.
So Mackenzie would like to present the poster, and let's start from her poster.
Okay, Mackenzie? Okay.